the Right Honourable Prime Minister, who is our guest of honour this morning, the CDC Country Director, we have the Acting Director General Health Services, who is here with us. Dr. Mwevesa, please stand up for recognition. He has not been recognized. The CDC Country Director, the District Chairpersons here present, our international partners from Pepper Janssen, our health implementing partners who are here present, the Executive Director, Baylor Uganda, Dr. Ade Kekitinwa, distinguished guests in your various capacities, ladies and gentlemen. Allow me first of all to welcome our guest of honor, Right Honourable Prime Minister, to this very important meeting, and thank you for accepting to come and officiate at this very important leadership summit. Allow me also, on behalf of the Ministry of Health, I know the Right Honourable Prime Minister will welcome you on behalf of government, but allow me on behalf of the Ministry of Health to welcome you to Uganda, which, as you all know, is known as the Pearl of Africa. Right Honourable Prime Minister, I want in a special way to extend my gratitude to the leadership in the Ministry of Health, Baylor Uganda, and our international partners, Pepper Janssen, Pharmaceutical NV, Ralph, and Lewis, and the Cross-Sector Leadership Exchange for organizing this very important and wonderful summit. As you all know, leadership is key in all that we do. In the health sector, we need leadership to be able to drive the sector to achieve its goals. You are all aware that with the rapidly changing healthcare landscape and the challenges that we face, with the population increase and the need to provide quality healthcare to our populations, we need leadership to be available, someone in the driving seat to be able to take us to the next level. We are partially here to celebrate the achievements that have been attained over the years, partially because of the leadership of a great lady, Dr. Kekitinwa. Right Honourable Prime Minister, I want to confirm to you that wherever Baylor has been, there is a difference. And we want to appreciate that. They have been able to improve the quality of care in most of our facilities. And if you go to the regions where they are operating currently, there is a difference with the other regions. The chairman from Kabarole district is here, and he's here as an example. And we always encourage the other districts to really move to these regions where Baylor is operating to pick a leaf from there. And that is why even us, as Ministry of Health top leadership, we had our retreat in Kabarole Regional Referral Hospital just last year because of partially. We wanted the directors from the regional referral hospitals to be able to appreciate what is going on in this region. Right Honourable Prime Minister, allow me to indicate to you that yesterday I did launch the quality health care in pediatrics. As you all know, we have been providing healthcare services in this country, but we have not focused on the issue of quality. And therefore, yesterday, I launched the standards, the pediatric quality of care framework and standards that should be able to guide our health workers in provision of healthcare services in the various health facilities. Right Honourable Prime Minister, you are aware that as a health sector, we have challenges. And these challenges cannot be addressed without adequate resources. We want to appreciate USAID, the US government, of course, CDC, for the support that it has been able to provide, of course, through Baylor Uganda. Our laboratories in Eastern region, in the Rwenzori region, have been equipped. Human resources are available. supplies have been available, and you cannot talk about quality health care. You cannot talk about leadership without providing the other tools that people need to actually undertake their tasks. So, Right Honourable Prime Minister, this caring together has improved the quality of health care in these regions, and I just want to assure you, all the partners that have funded this initiative, that as Government of Uganda, we are willing to continue supporting these regions by providing the necessary, of course, the equipments are there. We need to ensure that the equipments are maintained. We need to ensure that the human resources are available, and the Prime Minister will indicate to you later what government is actually doing. We've had challenges in motivating our health workers, but this is going to be a focus area in the coming financial year. Allow me, Right Honourable Prime Minister, to end by saying that Baylor has done a commendable job in improving services in the region where they have been operating, and I have no doubt that they will continue doing so with support from the various partners. And if there was a way, I would actually recommend them for further funding from the various partners who are here. They actually use whatever resources that they are given to do the work that they are meant to do without diverting. And this is not, this is something that sometimes is a challenge. But I also want to appreciate the great lady, Dr. Kekitinwa. You are a different person. You are not. Despite her height and size, she's an exceptional leader. And when we are talking about leadership in healthcare, she's one example of a leader. She actually moves and runs. And if there was a way, we would move you. If I had my way, I would move you somewhere else so that you can provide, that leadership. So, Right Honourable Prime Minister, with those few remarks, allow me once again to thank all of you for turning up. Today is World Malaria Day, and therefore, we also need leadership, Right Honourable Prime Minister, in ensuring that we have a malaria-free country. So leadership is required everywhere. You can have your strategies, you can have your policies in place, but without somebody in the driving seat to actually give direction, you cannot achieve your targets. So we are happy, Right Honourable Prime Minister, that you and His Excellency the President are at the forefront of actually leading us in this country to ensure that we achieve our SDG targets by 2030, a malaria-free country, eliminate HIV, and equally TB, which are our biggest challenges. With those few remarks, ladies and gentlemen, it's now my humble pleasure to invite the Right Honourable Prime Minister to make his remarks. Thank you very much.